My name is Galazka. I'm head of Department of General Endocrine and Vascular Surgery, Medical University of Warsaw. First of all, I would like to thank Professor Grzegorz Szkinis and Dr. Jan Skowroński for a very kind invitation to this Congress. I would like to present our experience with the new stent graft. The name is Nexus. This is technical details about this new stent graft in aortic arch. It consists of two components: the main body to the aortic arch, and the second one is a segment to ascending aorta. This is technical details about the new Nexus system. This main body selection and ascending module length guide. This is very important information about the system. This is our case presentation. It was a 42 years old female with Marfan syndrome and chronic residual ascending aortic dissection following aortic root surgery. Dissection of the descending aorta with aneurysmal dilatation of the false lumen about 55 millimeter and fusiform infrarenal abdominal aortic aneurysm above 75 millimeter. The ascending aorta was dilated above 50 millimeter with probably a perianastomotic leak identified in angio-CT. We prefer the stage operation of this patient. The first stage was carotid to carotid bypass from right to left common carotid artery with the transposition of the left subclavian artery. The second stage of the treatment, the implantation of the Nexus, the new stent graft in aortic arch. The surgery was carried out under the general anesthesia. The first step of the endovascular treatment, the introduction of the main body through the femoral arterial access. The next step is a proper positioning of the system. This is very, very important step. And the second one is deployment of the main body of the aortic arch and deploy the branch to the brachiocephalic trunk. After this, introduction of the segment to the ascending aorta, proper positioning of the ascending aortic segment. This is very crucial point of success of this operation. This time we use the rapid pacing. It's very important that a good cooperation with anesthesiologist, in our opinion, is a key point during implantation of the stent graft in aortic arch. The next step is implantation of the ascending aorta segment. This is a final angiography following the Nexus stent graft system implantation. You can see the complete exclusion of the aneurysmal in aortic arch and the good patency of the brachiocephalic trunk. We combined complete treatment of this patient. The next step, the implantation of the inner branch endografts in abdominal aortic aneurysm. We published this success in Vascular newspaper in September 2020. On the right side of the slide, you can see the complete exclusion of the aneurysmal sac in thoracic and abdominal aortic aneurysm and good patency of the branches in visceral arteries. This is a full metal jacket. In our opinion, the Nexus may be good as a Lexus. Thank you very much for your cooperation.